And local health experts are issuing warnings now about what cold weather could mean for the spread of coronavirus. Good morning, El Paso's Madeline Audley is live to explain how they're urging behaviors as temperatures drop. Good morning.
Good morning, Hillary. One of the biggest concerns for health experts as we get closer to winter is that overlapping flu season. Flu and COVID-19 can share a lot of the same symptoms, which makes it a lot harder to tell them apart. There's also concern that with so many of our hospitals already at the brink, those added flu patients could overwhelm our healthcare system.
We are afraid that this is going to make another spike in cases come when we have right now learned our lesson that these patients can really turn the medical system into really hard capacity because of the number of people that end up in the hospital. We want to avoid people being hospitalized, and having a peak of influenza and having a peak of COVID-19 will be very hard to deal with.
The CDC says it's not yet known whether weather and temperature can affect the spread of the virus, but Dr. Meza says human behavior in the cold can. That's because many people will choose to move their gatherings or their activities indoors. And he says that can make it easier for the virus to spread because airflow is minimized and the virus could stay in the air for several hours versus when you're outdoors, there's more airflow moving around and keeping that air going. Another concern as the temperatures start to drop are those patients who have actually been moved outside to manage the surge in coronavirus hospitalizations. University Medical Center has actually set up tents to house additional patients outside. A spokesman for the hospital does tell us that those tents have been heated, and he says that many of the patients inside those tents have actually already recovered and are now just waiting to be discharged. Reporting live outside of University Medical Center, Madeline Audley, Good Morning, El Paso.